Why do athletes sometimes develop LVH? Have you ever wondered why some athletes develop left ventricular hypertrophy? This condition can seem puzzling, especially since these individuals are often in peak physical condition. Let's break it down. Left ventricular hypertrophy occurs when the heart's left ventricle thickens. This is the chamber responsible for pumping oxygen-rich blood throughout the body. For athletes, this thickening is usually a response to the demands of intense training. When athletes engage in high-intensity workouts, their hearts adapt to handle the increased workload. As they push their bodies, the left ventricle responds by increasing the thickness of its muscle and sometimes enlarging its chamber size. This adaptation allows the heart to pump blood more efficiently during exercise. It's a normal physiological response rather than a sign of disease. However, it is important to differentiate this from left ventricular hypertrophy caused by hypertension. In cases of high blood pressure, the heart muscle thickens due to chronic pressure overload. This means the left ventricle has to work harder to overcome resistance in the blood vessels. Over time, this can lead to complications like heart failure or arrhythmias. In athletes, the increase in muscle mass is a healthy adaptation to regular physical activity. This form of left ventricular hypertrophy is often referred to as athlete's heart. Unlike the pathological changes seen in hypertension, athlete's heart is generally benign and can reverse if training intensity decreases. Both conditions lead to changes in heart structure, but the triggers are different. In hypertension, the heart faces increased workload even at rest. In contrast, athletes experience this increased demand only during exercise. For athletes, it is essential to monitor heart health. They should be evaluated for underlying hypertension or other heart conditions, especially if they experience symptoms like chest pain or shortness of breath. Regular checkups can help distinguish between athletes' heart and hypertensive heart disease. Managing high blood pressure is vital to prevent or reduce left ventricular hypertrophy and its complications. Athletes should be aware of their heart health, as understanding these differences can lead to better care and outcomes. In summary, athletes develop left ventricular hypertrophy as a natural response to their training. While it resembles the thickening seen in hypertension, it is usually a healthy change. However, awareness and monitoring are key to ensuring long-term heart health.